Thank you very much. We may be seated. Honorable Aden Duale, Cabinet Secretary, Ministry of Health, Mudomi Njuki, my apologies, Vice Chairperson, Council of Governors, and Governor of Tharaka Nithi County, Johnson Sakaja, Governor of Nairobi County, Governors present, Principal Secretaries present, County representatives, our development and implementing partners, healthcare professionals, and frontline health workers present. Ladies and gentlemen, good morning. Every mother remembers the sound of her baby's first cry. It is the most honest sound in the world. Relief, joy, and terror, all in one breath. That sound is what we are here to protect. I bring you warm greetings from our President, Dr. William Ruto, who in officially opening this summit yesterday reaffirmed his commitment to strengthening healthcare and improving the well-being of every Kenyan. In healthcare, a promise is not measured by the words we speak. It is measured in lives. It is the mother who walks home with her newborn, the premature baby who defies the odds, the patient who finally gets care when they need it most, not when it's convenient for the system. It is therefore incredible to join you for this important conversation, from promise to practice, delivering quality health services for every Kenyan. I relate to it because I know that feeling of sitting outside a hospital room and waiting for news. I know the prayer that a mother makes when someone she loves is in the hands of a healthcare worker. And that is why, when we talk about healthcare systems, I not only hear the language of policies and numbers, I hear the voices of families. In every facility we strengthen, every healthcare worker we support, every service we bring closer to our people brings us one step closer to the Kenya we want for our children. A policy becomes meaningful when a mother feels safe in a maternity ward. An investment becomes meaningful when a newborn survives. A healthcare worker becomes empowered when they have the tools to save a life. And a health system becomes successful when a Kenyan does not have to travel hundreds of kilometers to receive care. Ladies and gentlemen, in May this year, we launched the Every Woman, Every Newborn, Everywhere, Iwene Acceleration Plan, where we made a promise that no mother, no child should be lost to something preventable. So we must ask ourselves honestly, how do we turn that promise into a daily reality? The answer is not complicated. It takes leadership, investment, skilled healthcare workers, reliable equipment and supplies, referral systems that actually work when a life is on the line. And above all, it takes accountability across all stakeholders in the healthcare sector. The numbers tell us how urgent this is. Kenya's Iwene framework estimates maternal mortality at roughly 355 deaths per 100,000 lives births, with neonatal mortality around 21 per 1,000. But I want us to remember, those are not just numbers. Behind every single one is a mother, a newborn, a family that carries that loss forever, and a community that feels it too. So we cannot be satisfied with progress. We must insist on impact. As a goodwill ambassador for newborn screening in Kenya, I'm encouraged by what the Ministry of Health has already committed to. Under the IWENE Acceleration Plan 2026-2028, we are expanding maternal health care coverage through the Social Health Authority, investing in essential maternal newborn commodities, family planning supplies, recruiting and redeploying thousands more nurses and midwives. Today, we have heard what happens when promise becomes practice. We have heard about Pumwani Hospital that has had near zero maternal deaths. This has been through strengthened systems and relentless focus on quality care. We have heard about a maternity team in Kisii that went a full month without losing a mother. For that team, that is not statistic. That is a month of families going home together. And we will hear about Mwai Kibaki Referral Hospital, where more than 15,000 people have been reached in their communities for screening. 15,000 opportunities to detect disease before it becomes a tragedy. These stories tell us something important. The Kenya we want is not an impossible Kenya. We have already seen glimpses of it. Our task now is to make those glimpses the standard. Ladies and gentlemen, let us build a Kenya where a mother does not have to be wealthy to receive quality care, where a newborn's chance of survival is not determined by the county in which they are born, where a health worker is not sent into a crisis without the tools to respond, where a family does not have to choose between seeking treatment and putting food on the table, where quality health care is not something we promise our people, but something they experience. That is the Kenya we must build. That is what moving from promise to practice means, and that is the responsibility we carry together. Let us not be the generation that simply made promises, but be the generation that kept them. Okoa mama, okoa mtoto. Save the mother, save the child. Thank you. May God bless you all. May God bless our great nation of Kenya. Thank you very much. Thank you for the great work. I wouldn't want to say more than this, Waziri, because this issue of mothers touches all of us. Let me stop there. God bless you.